The symptoms started well over a year ago playing golf. Every time I finished my swing, it was like a terrible pinch. And no one believed that at my age it was a case of needing a total hip replacement. The whole internal joint was shot.
My name is Sebastian Rodriguez-Elizalde. I'm an orthopedic surgeon here at Humber Hospital. I'm privileged that every day I get to go to work and do something that I love doing and being able to help people. To hear that they can play with grandchildren again, that they can squat again, just the look on their face is intensely satisfying. Direct anterior approach hip replacement surgery is something that I was exposed to in my surgical residency in Ottawa. In Toronto and in the GTA, it really was non-existent up until I think we introduced it. And honestly, it was the patients, actually, that were my greatest inspiration for it. It was the patients telling me that this is a remarkable recovery. How's that feel, pain-wise?
Good, yeah. I mean, every time I step in it, I feel a stretch through here.
And stretch, yeah.
Pain first?
Pain, and then the right leg. You're making it look easy.
A large degree of my practice is younger patients, and this is a population that is still working, that is still contributing to society, that still has families.
This is very clearly an area that needed to happen, and it makes just so much sense. It's less muscle dissection.
So that significantly decreases our patient's length of stay. And not only decrease the length of stay, but it minimizes the amount of pain.
Today our patients come to our surgical daycare department, have their surgery the same day, and they're able to leave mobilizing and pain-free.
And gets the individual back to work a lot quicker.
I have had a remarkably quick recovery.
You feel you can drive?
I have driven several times this weekend.
I've had no problem with it.
I have not required any painkillers since I left the hospital.
We didn't play squash on this one.
I did not play squash, no.
The first morning I woke up, I literally woke up and started thinking about my son's project I was going to help him with that day, and it wasn't until I swung my legs over the side of the bed that I even remembered I had had a hip replacement the day before. It's crazy.
Change does not come cheap.
Without donors, the Hannah table would not have been possible.
And it was the patients that actually fundraised for our first Hannah table here when it was on trial. Donations help us in terms of advancing technologies and in the creation of new programs.
It's a horrible shame that people are waiting as long as they are to have this operation, that currently it sometimes takes up to a year just to see an orthopedic surgeon. I think the more we can do to reduce that waiting time, to make this operation more readily available, to have these ORs going all the time so that people are getting them much more readily and quickly when they're still in good shape, the better off society is going to be.
There are numerous surgeons who come quite frequently to watch Dr. Rodriguez do the anterior hip replacement from throughout Ontario. As a surgeon, he's certainly highly skilled, and I've learned a lot from him.
I mean, I can help one patient at a time, but in creating a program now, we can help several hundred people at a time. And I think that it's having that vision of creating a goal of what we want to do is really how we're going to change medicine. It's not just one person at a time anymore. Like I tell my kids, I'm just trying to make myself better. And I think it's being able to look at yourself every day in the mirror and say, what could I have, improved upon? So I think that constantly making myself uncomfortable to perform better is the way I see my job and what I do.
And it's for that reason, for showing us the way on how to do this, that Dr. Rodriguez deserves to be the Doctor of Philanthropy.